Mrs. Riopelle, we have heard a lot that, love goes through the stomach, and apparently so does the weight. So I have heard a tremendous, and have myself actually done a few, colon cleansing. But by colon cleansing, I'm not talking about sticking a tube into your back and flashing it all out. I'm talking about some type of diet which kind of breaks loose the feathers in it and takes a few pounds off right there. But more importantly, makes it then able to that any and all other foods, including vitamin, we talked in another video, get able to reach the body and the body parts it should reach. Basically, it can get absorbed. What do you think about that?
You're absolutely right. Over time, our intestines start to not absorb our foods and nutrients because of a malfunctioning border, and the foods just go undigested. And even so, if we are eating a good diet, we may not be absorbing it. So it's worthwhile to detoxify your colon every once in a while. And we can actually test for problems with permeability and absorption through the intestines. It's a simple test done in the office. And then there are various protocols to actually help the intestines from taking an oral preparation to detoxifying heavy metals to whatever is wrong in the colon should be found out first, and then replacing what's needed.
Okay, so it is an important thing to take care of in order to absorb what's going in. I mean, it's like the way I look at it, it's probably like with a house plumbing, right? I mean, all of a sudden the pipes get all lined up. And again, not only do they accumulate weight and show up in the belly, but at the same token, whatever you do put in simply, cannot be reaching the body anymore, and that seems to be a good thing. So there are tests to see whether such a cleaning would be indicated. There are tests which show you that your nutrients do not reach where it's supposed to reach. Is that what you're saying?
Yes, that's exactly what I'm saying. So if the test comes out completely normal, then we don't need to worry about it in a certain year. But if they come out abnormal, then it's to the patient's advantage to go ahead and treat the colon so that quality of life and the patient will feel better, and then we can go on and look at it and other things higher up, the small intestine, the stomach, the gallbladder, the liver. All these places can have sources of toxins or problems with functionality, and so the colon is usually the first place that we do start when we're looking at the system.
Okay, so that is actually one of the very first thing you examine, because apparently that's a big center point. That's where it kind of all, starts.
That's correct.
Makes sense, because that's where the food ends up, rather fast, right?
Mm-hmm.
Okay, well, thanks again. Thank you very much. Bye-bye, Mrs. Riopelle.
Thank you.